Hello and welcome back. My name is Max Crampton Thomas, the regional editor for the South Region for Capital Analytics, and today's video is brought to you from the Invest Nashville 2022-2023 Launch Conference. The third and final panel of the Launch Conference was titled A Complete Ecosystem: How Healthcare and Higher Ed Drive Economic Development Across Nashville and Provide a Unique Opportunity for Regional Growth. Moderating today's panel is Dr. Jenny Sauls, Director for the School of Nursing of Middle Tennessee State University. And our panelists included Chris Sterling, CEO and CFO of the Surgical Clinic, Dr. Greg Jones, President of Belmont University, Dr. Joseph Webb, CEO of Nashville General Hospital, and Dr. Shana Jackson, President of Nashville State Community College. Don't forget to like, comment, and subscribe, and we hope you enjoy today's panel discussion.
Good morning, everyone, and thank you again for having us today, and welcome to the panel members. I certainly did enjoy that last conversation about our financial structure right now and the challenges that are facing us. So I'd like to introduce our panel members. Mr. Chris Sterling, CEO and CFO of the Surgical Clinic. Thank you, Chris. Dr. Greg Jones, President of Belmont University. Thank you, Dr. Jones. Dr. Joseph Webb, CEO of Nashville General Hospital. Thank you for being with us. And Dr. Shana Jackson, President of Nashville State Community College. Thank you guys for being here this morning. As we think about the relationship of higher education and healthcare, looking back just a little bit, I have some questions for all of you, and then I have some specific questions for each of you. So in thinking about how Nashville enjoyed the before Nashville enjoyed the economic diversification that we currently see, it was and still is a global healthcare hub with a number of high quality educational institutions around the region. So how will both of these sectors continue to play a critical role in the region's economic development, both supporting new industries and in your own right? Okay, Chris, looks like you're it.
Start one on, and I just want to say I'm really honored to be a part of this panel. I'm usually surrounded by doctors, and that hasn't changed today. So, yeah, I think you're right. Nashville does have a long history in education with wonderful institutions that are represented up here, some that aren't, and a long history we've talked about in healthcare. And I think as it continues to evolve, we need more healthcare professionals. We need nurses, we need medical assistants, we need physicians for sure. So I think, you'll continue to see that evolve, that piece of it. And as, another part of it is as healthcare continues to evolve in general, the industry, especially the technology side of it, I think we'll see more programs revolve around training those kinds of specialties and those kinds of employees, and how do we make our healthcare system work better for us? How do we make it more efficient? So I'm really excited to see those kind of things.
There is some excitement going on.
Good morning. I attended Tennessee State University back in the day, and at that time, the music industry was what you thought of when you thought of Nashville. And now we understand that the healthcare industry is somewhere 5 to 6 times the size of the music industry. That's phenomenal. And I see it as a symbiotic relationship between the two. Back in graduate school, we learned about and being trained to be healthcare leaders. We learned about education. We had to study that because of the closeness in the relationship. But I see it as a mutual feeder. The educational system feeds the healthcare system with well-trained individuals, and the healthcare system feeds the educational system with opportunities and jobs. So that symbiotic relationship will continue to grow and prosper, I believe.
We certainly can't have one without the other. That's true.
I think there are huge intersections, and it's part of the dynamism of Nashville. If you look at the HCA family tree of entrepreneurial ventures that started in Nashville, it's broader than traditional physicians, nurses. It's a lot of the kind of entrepreneurial spirit that I think characterizes Nashville. And so I think of education, I think of healthcare, and I also think of that entrepreneurial mindset, that entrepreneurial spirit. And part of what's characterized Nashville is being a leader in anticipating where healthcare is going. We've clearly got workforce issues and the need of more people, as Chris was talking about, and addressing some of the equity issues in how the health of our population in the Metro Nashville area. And that's something where education, healthcare, and entrepreneurship can intersect as technology comes in to a greater role in business. It's a chance for Nashville to build off the kind of intersections and great relationships that we have. We're starting a new College of Medicine that pending accreditation will start new medical education in the summer of 2024, building on our nursing and health sciences programs, as well as our College of Pharmacy, all of those workforce dynamics. And, what we need is the kind of collaboration that exists all across the board. Nashville State plays a really key role in equipping people across the healthcare work. And so Shauna and I have been talking about how to partner in deeper ways to address those workforce issues. If we don't do this in a way that's focused on the future, we're going to find ourselves regressing. It'll have impact not only on our educational institutions, on the healthcare that places like Nashville General and others provide. It'll also affect our overall economy and the well-being of the region.
And I agree with everything that's been said. It's really a new opportunity, I think, to help our local talent get on a clear pathway to jobs they don't even know about, really, and to make it very clear that there are a lot of entry-level positions for which Nashville State may prepare students for, or you have specialized workforce training, but there's a pathway in the healthcare industry that isn't as clear as you might think it is. And so how do we simplify that for the folks that are looking for great careers and great organizations to work for, when really all they know are doctors and nurses, and they don't know the diversity of the fields that they're in. So I think, we're interconnected and always will be. Workforce is certainly an issue that I'm sure we're going to talk more about today, but just the overall health of our communities is an education piece as well, and helping them to understand what we need to do to take care of one another so that we can have long, sustainable lives.
Mhm. Very insightful comments. Thank you. I have one more question for all of you. So in looking back over the last few years, I think we'd all agree there's been some significant disruptions in the way we operate. So as you start to look at and tackle the challenges of your respective industries, how is it that your work is being carried out across Nashville and Middle Tennessee in response to those challenges? And what are the biggest changes you've made in your respective industries in response to the challenges that we faced in moving forward successfully?
I can go first this time. I think that we are still trying to navigate this new normal. It keeps changing. So I don't know that we've arrived at the new normal yet. Nashville State really was impacted by COVID, and not just student enrollment, which definitely was a hardship, but just by the changes that we needed to make and how people teach, how we interact with each other, this whole virtual workforce that we're still trying to figure out. And I think some of the good things that came was really the innovation that took place, that we had to move quickly. And if you know higher ed, that's not necessarily what we're known to do, although we're working to change that, to a virtual environment, to a different way of learning. And so what I really see is that we are blurring the lines. And often on the higher ed side, we talk about the credit side of the house, which is degree programs, technical certificates, pathways to great institutions like Belmont, or putting people into work, or the workforce side of the house, which is what we refer to sometimes as non-credit, where it's for basic skills or specific training or customized training. We're blurring the lines because employers need employees today, not 2 years from now, not 4 years from now. And at Nashville State, we really actually made a realignment and put our workforce division under our academic affairs so that they were connected. Everything we do at Nashville State is workforce development. And we wanted everyone at the organization to understand that. Also, the unique partnerships. Belmont has been an exceptional partner with Nashville State. As we're talking about healthcare, we have an articulation agreement where they save 16 seats in their nursing program for our students. And we're building stronger relationships. We were already focused on holistically supporting students, but I think not that we're post-pandemic, I think we're still coming out of it, even more strengthening the supports so that students can not just access education and training that you want them to have, but they can complete it. So there's a lot of innovation and a lot of collaboration all across higher education and with our partners to redesign the system. Because if we're really candid, it hasn't worked that well for students or for employers for a while. And so we're very interested at Nashville State. And I mean, we've got great partners on this panel to redesign the system so that it actually works.
I'll follow up on what Shauna said. And when she mentioned higher education is not always nimble, that's an understatement. I say, you know, much of higher education across the US and in Western Europe is preparing for 1995 in case it comes back again. And so, you know, the reality of these multiple disruptions that we've had, it's not only COVID, it's the racial injustice, economic disruptions, it's mental health challenges. It's happening on so many different fronts that it's really challenging. And I think Shauna pointed to something really crucial, particularly when we think about the healthcare workforce. If you look at the physician shortage that's going to occur over the next decade, the nursing shortage that already exists and is going to intensify, as well as all the other kinds of roles of medical assistants and physical therapists, just run down the list. There's no way that we're going to be able to address that adequately only through long-term 4, 6, 8-year programs in some of these areas. And so we've got to be doing educational innovation, finding new pathways. Over the last 6 months, I created a whole area just called educational innovation, looking at more of those kind of new pathways. And that's part of what we talk about, is how do we develop that? I want to help Nashville State develop pathways for people who will never come to Belmont, but will get good jobs, because that's how people are going to flourish. And we're going to need to develop those new pathways of educational innovation. We also have a whole new area that Josh Yates is leading called the Belmont Innovation Labs, that are designed to incubate ideas and to work with partners. And part of the key aspect of dealing with the disruptions is also listening to our partners in industry, people who actually run hospitals and dealing at community clinics and, you know, places like Siloam, and say, what are you experiencing both with your workforce as well as with your patients, and how those dynamics, you know, when I talked to Morgan Wills at Siloam, and he talks about dealing with immigrants and refugees that speak 78 different languages. Well, that requires an intercultural competence from our workforce that we've got to be responsive to. And so working in those sorts of ways, it's going to require intrinsic partnerships between education, healthcare, business, government, all of the different sectors, intrinsic partnerships rather than kind of transactional relationships to address the needs that we're facing with disruption.
So I'm going to kind of redirect us a little bit more towards healthcare and how the disruption that we're referring to could largely be summarized under COVID. And we saw something in our community. I call it the unintended innovation. We learned how to work from home. We learned that we didn't have to always get in the same room to meet. We could meet virtually. So it was an innovative period that has built sustaining practices for us. But we also saw a very disproportionate impact on marginalized populations, people of color, the mortality rate. And what it did was it just exacerbated what already exists. We know that there are health inequities, and we know when inequities happen, there is an undesirable outcome. And so one of the things that we're doing at Nashville General is we're focusing on risk stratification and dealing with that high risk population, because it is a way of, as the essential hospital for the city, the public hospital for the city. It is a way of controlling the cost, keeping individuals well, keeping them healthy, keeping them educated. And so we target the population through our risk stratification. And then we educate those that are dealing with those chronic conditions such as diabetes, hypertension, congestive heart failure, COPD. We target those individuals because the science shows that anywhere from 6 to 7% of your population will usually drive 60 to 70% of your cost. So if you can get that population under control by being proactive, reaching out to them, keeping them healthy, educating them on their conditions, because I always say the best healthcare you're ever going to get is the healthcare that you administer to yourself, because that's where you spend most of your time is at home and not in a hospital or in a healthcare setting. So I think we learned a lot through that disruption that's going to sustain and remain with us for a long time. And I think we're better off for having done that. We just have to respond in a way that is in the best interest of the entire community.
I don't know if it's on purpose. Sorry, I don't know if it's on purpose, but we have the educational side there and the healthcare side here. I found myself in 2019, early 2020. I was going into my third year of being the CEO of a group of almost 40 surgeons. We were faced with, the most challenging healthcare crisis that we've ever seen in my lifetime. And to say that was a difficult situation is to put it mildly. We learned fast, and we reacted. I was very proud of the way that we handled it and our staff. I think when we're looking at how we've changed from then, there are a couple of different areas where we focus. One, administrative. I'm lucky to have most of my team here, and I'm so thankful for them because we had to learn how to be more efficient, how to work more proactively, handle our responsibilities in different ways. And work from home was a lot of that. But also, I think, we tried to find people that were better suited for what we needed. And that was kind of a natural course of going through, filling positions as there's turnover, and everybody's had turnover, looking for different things and what we need out of the employees that they're doing the job of what we need. On the other side, the clinical side, again, we're a group of surgeons. I don't really want a whole lot to change. We went through a period where, you're trying to maybe have minimal contact with our patients because you're worried about spreading a disease that you may or may not know that a patient or you may have. But at the core part of our business is patient care. And I strongly believe that an important piece of that is contact with the patient, human contact with the patient, spending time with the patient. And again, when we usually see people, it's not a really good day in their lives. They're seeing us because, they're going to have to go have an operation, have surgery. And most people are pretty scared of that. So, it's important for us to have that human contact and interaction to put patients at ease, to let them know what's going to happen, what's going on. They're going to be okay. And that's one thing I want to get back to where we were before. And for the most part, we have. So that's kind of how we would.
Yes, I think the pandemic sort of separated us all from our major constituent. In other words, it separated education from its students by going to the virtual world, and it separated healthcare organizations from their patients. So it really did change the way we look at things a lot and made things more challenging for us. But I think everybody can tell from the conversation we're having up here that this adversity probably did actually end up bringing out the best in us and challenging us to look for new and better ways to do things. And I think we've discovered that. And I think we will continue to use some of the changes moving forward to do things better. So
I will add though that I'm tired of Zoom and I'm tired of teleconferences.
Yeah.
I'm much happier to be in-person meetings now and this in person, and I'm much more happy that that's happening.
yeah, it really face-to-face is really the best. I have to say I agree with that as well. So so we've been talking a little bit about the past and how that's impacted us. So in looking at the current landscape, this is another question for all of you. So I think we all know that Middle Tennessee has long maintained an educational ecosystem that has allowed residents and employers alike the ability to study and recruit locally. So how has the recent influx of new employers and the growth of ones who are already established created a heightened demand or an increase in demand for talent? And how has that growth prompted a change in what may be expected when it comes to the quality of our local talent?
I guess it's my turn to start this one. I think what we've seen anyway, is as our economy has grown, as more opportunity is created, new businesses, new industries move to Nashville. We don't see in that area a lot of competition for what we do, but we see competition for talent, maybe talent choosing to go into another industry other than healthcare. There are a lot more options, especially for local kids or local graduates that want to stay in Nashville. And I think we've already heard a lot today about how great Nashville is, and I agree. I'm not a native Nashvilleian. I've been here about 22 years, so this is home now. But I think we all agree how great the city is, and people want to stay here. It just creates more competition for really talented, educated, intelligent people that may be choosing a different industry over ours. And we want those people working in our industry. We need innovation, and we need ideas, and we need smart people in healthcare to help us solve the problems that we have. And it makes that a little more difficult.
Yes.
I think it's been through more of a natural transition of demand for one feeding the other. We at Nashville General have one of the oldest health sciences programs in the state. Our director of that program is right here at our table, Craig Shepard. And we've seen growth in that area. We're expecting that to continue. And as we focus on building a new hospital, we expect to see the actual physical attributes to that expand, so it will become even more, have more of an impact in the community. You know, ecosystems tend to self-correct. If it's truly an ecosystem, you really don't have to worry about artificially impacting it, because it's either going to be one where there is both, all hosts will mutually benefit, or it can have some type of parasitic relationship where one does well, the other one doesn't. But it is still a part of the ecosystem, and that's what makes it work. And it will survive until there is some tampering with that ecosystem that causes it to do otherwise. So I think as long as we allow the system, and we're putting a lot of resources into education, and countries across the world have recognized that if you want to grow the economy and the well-being of your country, you really have to focus on investing in education. So, I mean, that's something that goes without saying in Nashville. It's always, since I've been around Nashville for a lot of years, it's always focused on higher education, and it's obviously served the city very well.
I distinguish several areas where I think we need to work together. We need to do things internally, and we're, starting a College of Medicine in 2024. Faculty and staff are already on board, many of them, and will continue to grow. We want to expand health sciences and nursing, pharmacy, so that we can help meet some of this demand. We can't do it alone. It's going to require partnerships. Some of that is partnerships with other organizations like those up here. And part of that is a broader ecosystem that I'll come back to at the end. But I would say that we also have to be paying attention to our K-12 education. I say that's our supply chain. We've got to have that be really strong going forward. If you look at the number of jobs that are going to be created in Nashville over the next 5 years, it's at a much higher pace than it has been over the last decade or 25 years. We can't import all that talent. we shouldn't import all that talent. We need to be growing our own and equipping people who are growing. And that means attending to dynamics of education and how that works. And that's part of the pathways for people to succeed, to go from high school to Nashville State, not just a four-year education, or other kinds of opportunities and training programs that can equip the people for those opportunities. I'd say the last thing that we really have to attend to, and why those partnerships are essential, is that larger ecosystem. It's not only whether people come to Belmont or Vanderbilt or Lipscomb or Trevecca or Tennessee State or Fisk or anywhere else, or Nashville State or any of our colleges, or what they're going to do locally. We're also competing against Austin and Charlotte and New York and other cities. And I want Nashville to be the best ecosystem for education, healthcare, business more generally. And that means we've got to be pulling together, because if we have those intrinsic relationships, we're more likely to be dynamic and entrepreneurial and see the kind of transformation that would really enable everybody in Nashville to flourish.
And my lens is maybe a little different, because we are a community college. We serve 7 counties, and we are here for the local community. So we're not recruiting out-of-state students. We are certainly serving the ones that live here. I moved to Nashville in the 90s to work for the Pillsbury Company. Never thought I'd be in higher ed, but that's a whole different story. And Nashville looks so different now. And really, I would say the last 5 to 10 years, we've been using the strategy of importing talent into the region. And it's just not sustainable. You can't keep bringing in most of your talent from outside for the high wage, high demand jobs. And so we have to grow our own. We can look at data. We are leaving communities. We are leaving group of people behind. And so that's your local talent. There are plenty of people out there that are not accessing post-secondary opportunities or any kind of training beyond high school. And so they're not prepared for the jobs that are there. And I think that that is what we need to focus on. We know where the gaps are, and we know where the people are. So part of what Nashville State is doing, and I know Belmont is doing the same thing, is we're going to take the college to the community, and we're going to go into the promise zone areas, our federally designated areas, the underserved, because we're always asking people to come to us. And the one thing that is like my banner is access to education isn't enough. We have Tennessee Promise, we have Tennessee Reconnect. Shouldn't people be flooding into your institution? And they're not, because they don't have transportation, they have childcare issues, they have to work. And going to school while working, and many of you have probably done that, is hard. And if you're parenting, it's even more challenging. So I think this whole idea of the local talent, we have to rethink and not set the same expectations that I had. I knew I was going to college. That's not everyone's story. They're not all supported. And so I think this influx of wonderful opportunities, we have to balance that with making sure the local talent, the kids coming out of metro schools, the kids in Clarksville, the kids in other areas have the same opportunity to get access and completion of the training and the experiences so they can get the wonderful jobs that are available.
Absolutely. That's very insightful from each of you. I will say that we have never struggled before at MTSU to recruit nursing students. But since COVID, we have been struggling, as have most other programs in the state. Most of our students live in the state. Most of our students, probably 90%, remain in the state, go to work in the state. We like that. We want to be educating our students for employers in Tennessee. But I will say, just in the last 6 to 9 months, I've had Cleveland Clinic recruiting our graduates, Maine recruiting our graduates, Mayo Clinic recruiting our graduates, Children's Hospital in Atlanta recruiting our graduates. So we really want our students to stay in the area. That's
a broader entrepreneurship question of, are we creating communities and neighborhoods where people want to live, and are we working together?
Yes.
And I would say one of the things we have to attend to is also the rural areas around our cities, because if the rural areas aren't discovering new life and healthy ways to live in places
Yes.
that are desirable, then it's going to be even harder for us to retain the top talent
Yes.
that's homegrown.
Yes, I think that's absolutely correct. So now a question for individuals. So Chris, in your interview with Invest, you spoke toward the interoperability of data systems across healthcare networks and trickle-down impacts on the cost and coordination between providers, insurers, and hospitals. Having said that, are there ways that Nashville, with its robust healthcare ecosystem, can help lead in formalizing and consolidating these systems so that it benefits all of the parties involved?
So a little bit of background on that comment. Again, we're a group of surgeons, so we have a lot of partners that we work with, and we're hopefully very soon going to be partnering with Dr. Webb here. Very happy about that. So we work with hospitals, we work with anesthesia groups, we work with other physicians that refer us patients, or we refer patients back to them, like oncologists. We work with insurers. They're obviously big parts of what we do. Each of these parties generally has a different information system. You have a medical record at the hospital. The anesthesia group, most of them will have a medical record on you. We will have a medical record for you. Your insurance company certainly has your medical information. What we do a really poor job of is communicating among all these parties what needs to be known. Now, my idea in a utopian world is, there's one record system that we all have access to. So when my surgeon is seeing a new patient in clinic, they can look up the patient and see, okay, well, they had this procedure at Nashville General last year. 6 years ago, they had this procedure at St. Thomas West. Oh, they've seen, these primary care physicians, and get a whole picture. We don't have that right now. And there are a lot of roadblocks to that. I think if that problem is going to be solved, and we're working towards it. There are some clearinghouses where we'll take our EMR data and share it across other partners, but it's certainly not holistic in any way. I think if that problem can be solved, I think there's enough talent and brain power and just smart people in Nashville to do it. So many people are moving here now, and most of those people are young, they're professionals, they're intelligent, they're driven, they're successful for the most part. So I'm really interested to see, and I said in the magazine, I think I'm really interested to see the innovation in healthcare technology and how we can solve some of those interoperability problems and inefficiencies going forward, because healthcare, we all know, is getting more expensive. The cost of healthcare is a problem, and it's not just a problem for patients, it's a problem for providers. As we see our costs every year ticking up and up and up, and for the most part, our reimbursements from Medicare or health insurers or whatever is not going up at the same rate. It's staying level. In some cases with Medicare, it's going down. That's a problem. At some point, those lines get close to converging, and that creates a real issue. So we need more efficient ways to do things. We need more efficient ways to work with our partners, how to lower the cost of healthcare. And I think, I don't think the cost of where we're seeing patients, real estate, we've talked about that, that's not getting any cheaper. The cost of our staff and people that we need to take care of our patients isn't getting any cheaper. So we have to find more efficiencies and other ways to make it make sense.
Great. Thank you, Chris. Okay, I'm being given the wrap-up sign. So we had a lot to say today.
We're
So
the last panel. Can't we go a little long?
You don't have anything to do you? You don't have anything to do you?
they're all going, yes, we do, probably. So Dr. Webb, just briefly, how do you think healthcare and higher education represent a complete ecosystem? And you've already alluded to this a little bit, driving the economic development and unique opportunities across Nashville.
As I said before, I think it's a symbiotic relationship. One feeds the other, and it's almost as perfect as you can get with an ecosystem. And as I stated, there's no parasitic effect here, so one doesn't harm the other. It is absolutely mutually beneficial. And it wasn't until healthcare really became such a prominent part of the landscape in Nashville and the economic system here that it really started to show itself just how effective it is. And I would believe that it is certainly the envy of a lot of cities that would love to see this type of dual economy driving the actual overall activities and the growth and development in the city. And you can actually say that with those two industries, that's what's fueling a lot of this ancillary growth that we're seeing.
Thank you for those comments. Dr. Jones, just briefly, we've been talking about opportunities for growth. So what do you see as issues that might impede our current momentum in moving forward?
I think we need a shared vision of where we want Nashville to go. I've been in lots of meetings where I hear we don't want to become Atlanta. And usually I think that's around transportation dynamics, but we need to not just know where we don't want to go. We need to know where we do want to go. And that's going to require us working together. I think it's going to require what's one of our strategic pathways we call an integrative vision of health and well-being for all. And that means, really looking at some of the health inequities in our city, looking at the broader region, and making sure we're working together, helping to grow that homegrown talent, building stronger networks, and creating the multiplier effects. If we don't do that, we're going to find ourselves trying to fix, we'll treat some of these issues as if they're hard problems rather than complex problems. One of the things I've learned, is if you don't have childcare, it's going to really affect whether people can show up to class and get a degree and flourish. If you don't have sidewalks, when you think about hypertension, our Belmont Data Collaborative worked with Nashville Health and identified that hypertension is highest in this region in neighborhoods where they don't have grocery stores and sidewalks. So your doctor tells you, you got hypertension, you need to eat healthier and you need to walk more. Not likely if you're in a neighborhood that doesn't have that kind of access. So it's going to require us working together with a long view of where we want to go, with a broad vision of what it takes for all of us to flourish. Nashville's a much healthier environment. And then in lots of places I've seen and lived, and what I would just say is what my colleague Charlie Apigian noted about Nashville is it's a great place for people to get along. It's harder to get stuff done. And what he means by that is we all say, yep, that's a problem. And then we wait for somebody else to do something. And he said, what we need are radical champions to get stuff done. And so I'd urge all of us to find ways to work on things and be a radical champion. Say, we're going to take this on and hope others will join. And that's how we're going to solve the problem.
Thank you for those comments. Dr. Jackson, quickly, where would you like to see more support on the part of our local stakeholders on tackling these issues?
Just what he said. We need to get moving. We need leaders that aren't going to just talk about it, but be about action. And I think there are some very real solutions out there that we just need to find that champion. I know Belmont is a leader. I mean, Greg is doing amazing things over there. Nashville State is committed to being a national leader in achieving equitable outcomes for our diverse community of learners. And I want you to think of Nashville State as your workforce solution partner. But there are issues beyond the college with transportation and childcare that we can't tackle alone. And so it is going to take those strong champions to gather the right voices in the room to not just discuss what it is we need to do, but to move to action.
Thank you so much. And thanks to all the panel members for your contributions to the conversation today. And thank you guys for coming out to listen.